Hello and welcome to the October 2025 webinar on Medicare for 2026. We have a lot to cover. My name is Nicole Christensen. I am the founder of Answers for Care and Care Answered. So first of all, Care Answered provides patient advocacy and care coordination for older adults and their families. We get healthcare done. And I am also the author of the best-selling book, From Crisis to Calm, and proud founder of Answers for Care, which is a premier one-stop shop for all of your senior care needs. And one of those premier pros, is our very own Jane O'Malley, who will be conducting this webinar on Medicare. She is an expert. I'm going to share a little bit about her in just a moment, because you can find her, you'll see it in the chat as well. Will be the link to Jane's profile on Answers for Care. And so hopefully you see it in front of me. She is dedicated to helping Medicare beneficiaries throughout the nation. So if you're not here in New York, potentially you're in Florida or any other state, she can still help you. So with the aging of America, the baby boomers are looking for assistance with their health insurance and financial needs. And she takes great pride in being that resource to accomplish their individualized needs. One of the major concerns a person has when they retire or turn 65 is how to cover or cap their medical cost, which can be catastrophic, which we all know probably no matter what age we are at this point. So her goal will be to accomplish this for you, for finding the most suitable yet affordable plan tailored for you. So Jane O'Malley from Senior Services Agency and a proud pro on Answers for Care is going to walk through some of the basics, some of the changes, and what you can look to for 2026 and how she can help. So without further ado, the very gracious Jane O'Malley.
Thank you, Nicole, and thank you all for being on the webinar. It's very nice to be here and try to bring you up to date. This is another year of disruption, unfortunately. Last year we had a lot of disruption, and this year doesn't seem to be a whole lot better. But I want to basically, or I should say, give you the basics of what you need to do. Assuming that some of you are just turning 65, you do need to contact Social Security in order to sign up for Medicare. And there are two parts that you need to sign for. One part is A, the other part is B. So we'll go over a little bit of the basics before we get into a little bit more of the choices of how you make your decisions with Medicare. With Part A, that's basically hospitalization. And what you see on the screen is on the right-hand side of that page is what you would pay if you only had A and B and nothing else. So in other words, you haven't had any other supplement, you haven't had any other carrier coverage, if you only had A and B. So the minute you would walk through the door is $1676 would come out of your pocket. That's your deductible for Part A in the hospitalization. If, God forbid, you were there longer than 60 days, now you're going to pay $419 a day. And then certainly, hopefully, you're out of the hospital. But if, God forbid, you're there for 90, now you're paying $838 a day. So there are big numbers there that we have to try to stop the gap. Underneath there, you'll see skilled nursing care. If you were to go into a rehab center, you had a knee replacement or something else is going on and you needed to be in rehab, Medicare will cover the first 20 days. After that, Medicare will not pay anymore and you will pay $209.50 a day. So again, many people don't know that. They think if they go to a rehab center that they're all good. but they soon find out that if they're there for more than 20 days, suddenly they're getting a bill and they don't understand why. Well, that's why Medicare stops. Hospice care is covered, blood is covered. So that's, those are things that we don't really need to talk about too much because that is already covered. On Part B, this is your medical. So this is similar to what you have always had with an 80-20. If I said 80-20, you know immediately what we're talking about. The carrier pays for 80% and you are responsible for 20%. This is how Medicare Part B is set up. So again, if you have just A and B, you do have a deductible of 257 this year. And then any of your medical expenses, you would be responsible for 20%. Now, if you had nothing else, that could end up being a huge bill, huge. I mean, we've had that happen. And then people will call, well, I finally got, was in the hospital, whatever, and I had a $400,000 bill. And then we're like, now what do we do? So you really need to cover these holes that Medicare, is showing you. The lab, the home health care, outpatient hospital treatment, blood, those aren't things we necessarily need to talk about too much. The only thing I will say is that home health care is not if you are home and you're, needing help for the next 6 months. Home health care on this particular piece of Medicare is only by prescription, and it's very short term. It could only be usually 2 weeks, maybe 3, depending. So, don't take home health care thinking that you can get somebody to come in your home every week for the next year. That won't happen. Okay, so when we have A and B in place, that is your major portion of Medicare. Now we have to try to cover the other 20% and things that aren't being covered by Medicare. And we have 2 options. On the left-hand side of the page, we'll go down that side first, which is called Original Medicare. Original Medicare consists of A and B, so that's your Medicare card. Then you add a separate drug plan, and then you add a separate supplement. There are premiums for every piece of this, with the exception of A. You never pay a premium for A if you have worked for 10 years, basically. But there are premiums for B, there's premium for D, and there's premium for the supplement. So yes, it's very good coverage. Yes, it's a good coverage. You're pretty much leaving no stone unturned and very little out of pocket, but you're paying a lot of premium. So that's Original Medicare. On the right-hand side of the page is Medicare Advantage. Medicare Advantage is a situation where A and B and D, so all of those pieces that you see on the left-hand side of the page are all in Part C, which is one unit. They're all together. Part A, Part B, and Part D is all in one plan. Some of these plans are 0 premium. Some of them are a smaller premium than the supplements. But the one thing that you must remember is that when you are on a Medicare Advantage plan, you are paying as you receive services. So when you go to the doctor, when you have physical therapy, when you have an MRI, when you break your ankle, whatever is happening, you are going to have a copay. So you pay for services as you receive them. Are you paying 100%? Absolutely not. The carrier will help you. Medicare is obviously paying the 80%. The carrier will help and you will pay the rest. So for people that are not in critical care, for people that are not in the doctor's office 3 and 4 and 5 times a month, this often is a good option. The other thing to kind of consider at this point is that the Medicare supplement plans, especially in New York, are becoming very expensive. And by the time that you add a drug plan to that, which some of them have doubled in premium this year for 2026, you're paying a lot of money out of pocket every single month. So if you're not using your plan, and I was talking to a couple this morning who basically go to the doctor 2 or 3 times a year, and maybe another doctor, every 3 months. And yet their basic out of pocket when the two of them were looking at their annual was $8,000. Are those visits worth $8,000? It's a small amount of visits to pay that much money for. So you have to be very vigilant about keeping track of what you're actually doing. If you are a critical, you have critical health issues, you need to be on a supplement because you need the care. But if you're not, a Medicare Advantage may work, or there is one other option for a supplement that's pretty different, but I'm not going to get into that now. So those are the major portions of Medicare, and how it's put together. Are there little nuances? Yes, absolutely. But that's where I come in and help you figure out what is going to work for you and be the most suitable.
One thing, Jane, I'd like
Yeah.
to add to what you're saying is
Mhm.
just because as a patient advocate, I hear this a lot, right? So going back to basic Medicare, Medicare A, when you see the skilled nursing or rehab, it's really important that everybody understand that you have to have 3 inpatient days, hospital days, in order to qualify for those rehab days afterwards to be covered. So that's a huge one because sometimes people will be held in the hospital and in the emergency room, but never admitted and still want that rehab care. That will not be covered by Medicare unless it's 3
Hospital.
inpatient hospital stays.
Mhm.
And so I just want to emphasize that because it comes up a lot. And the
Okay,
other
good.
thing that you alluded to, Jane, is that, Medicare is not for long-term care. It's not designed for that. So again, people often think it is and that they covered and they have great insurance. If it's long-term, um, it will not be covered. So what Jane had mentioned about, 6 months, a year of home care, that's not going to be covered by Medicare.
Right.
Okay, so I'm going to stop share because you're going to go into some of the details of all of these things.
Yeah, there's too much to cover, but we'll just kind of skim over the first things. One thing that a lot of people didn't understand last year, assuming that most of the people that are on Medicare already, is the Inflation Reduction Act. That went into place January of last year, or this year actually, 2025. And what that was, or how it affected us as Medicare clients, is that we now have $2,000 as a max out of pocket cost. So how does that work? Well, in the beginning, when I heard about this, I thought, well, this is maybe a good thing because there's so many of my clients that go like, oh, I'm on asthmatic medication, I'm on diabetic medication, I'm on this, I'm on that. And they're spending thousands of dollars a year to stay alive, basically. So the government actually decided, well, it's really not fair because these people are, sickly, yes, but the cost of medication is just very expensive, and therefore, they are spending absolutely too much money in proportion to, most of the other people. So they gave them the $2,000 as max out of pocket, and that included the deductible on basically every single drug plan that you can purchase. And with the deductible and with that, once they met $2,000, they were done. The carrier had to pick up the cost for the rest of the year. So that was fine. But what happened was the carriers now are like, well, we can't go bankrupt. So they have now increased many of their premiums. They've increased some of the copays for medication for all the rest of us. So the rest of us are, well, I should say the rest of us, but we're kind of picking up the pieces as well. So I'm not so thrilled with the Inflation Reduction Act because it's affecting too many people in a negative way. but it will help several people so that they, can at least not take medication. Many people will go, well, I just can't afford it, so I'm not taking any medication anymore. So that will avoid that. And also, if in fact you are a person that is on a high cost medication, what happens is when you go to the drugstore or when you get your mail order in January, you may have a very large bill. Number one, you have the large cost of the medication that you might be taking. And secondly, you have the deductible. This year for 2025, the deductible on almost plans was $590. Next year, it's going to be $615. So that is figured in the first month and or 2 or 3, depending on whatever medications you have. So if you get to the drugstore or you get your mail order and it's, let's say, $900 and you go, well, I don't have $900. The druggist is able to send that bill back to the carrier. The carrier will then divide that bill into 12 and then you will pay for that on every month. They'll send you a bill. And so you'll pay for that monthly as you go along. Now, usually in February, it's a little bit less because maybe you've met the deductible, and by March and April, it's less. So as the year goes on, if you can afford it, then by the time you're getting into the middle of the year and the end of the year, your drug costs your copays basically are going to be less. Hopefully that kind of makes sense. It's very individualized, so that's something where a broker can go through your drugs, which is what I do. I just to kind of let you know how I handle my clients. I have all of the names of their doctors. I have all the names of their medication and the dosage, and then I do the research. So I have platforms where I can bring up all of the carriers that are available in their area, compare and do the research and find the plan that is going to be the most suitable for them. So I can say to them, all right, your bill is going to be 600 and whatever dollars for January, but then it will go down to maybe 385, and then it might go down to 160, so on and so forth. So I can tell them how to expect the payments going throughout the year. And if they still can't afford that, then obviously the carrier will bill them throughout the year. I hope that makes sense.
So we have one question from Stephanie,
Okay.
which I think you might have answered. But is the out-of-pocket max 2,000 only if you have a supplemental plan, or
No,
what is that for?
it's
Okay.
for everybody, every single person. Yeah. And for 2026, it's going to be 2,100. So the 2,000 is now 2,100 for next year. Okay. Then another thing that kind of comes up and people are very confused about, and how do I handle it and what can I do? There are different enrollment periods. And many people are very confused about, well, can I call me? What can I do? Well, right now, October 15, which is tomorrow, Medicare open enrollment begins. It will end on December 7th. So you have these few weeks to make up your mind if you're okay where you are or if you need to make a change. And this is why the Medicare agents are just absolutely so crazy and can't answer the phone, because they're on the phone. But we will get back to you. I will definitely get back to you. But now is the time where if you are unhappy about the plan you're on, if you're unhappy about the premium, if you're unhappy about how the drugs got covered this year, if whatever is going on with you, now is the time to get it fixed, or try to get it fixed as best we can. So now is the time we have to change. You can change as many times as you want, but whatever is on, with Medicare on December 7th is what sticks. After the annual open enrollment in January, those that are on Medicare Advantage plans especially have another enrollment period called open enrollment. That starts January 1st, that ends on March 31st. So you have the first 3 months of the year to say, well, I kind of got on this plan. I don't think I like it. My doctor now is retired, is out of the plan, whatever's going on. You have the option to make one change or go back to original Medicare if you wanted to do that. And if you went back to original Medicare, then you would have the A, the B, the supplement, the drug plan, so on and so forth. Okay, does that kind of make sense? Other than that, there are really no other enrollment periods during the year, with the exception of a couple of things. If the state of New York or the government had a federal emergency of some sort, that creates an enrollment period for us. So if you had intended to make a change, you couldn't do it because of flooding or whatever was going on, then you would have an opportunity to make one change. During COVID and all, we had so many. I mean, it was like every other week there was another federal emergency of some sort. So we almost had the whole year where we could make changes for people if in fact they had a problem. The other thing that I won't get into the weeds about, but is Epic. So sorry. Epic is a plan that's set up by New York State, and it's originally set up for prescription. But now that the Inflation Reduction Act is in place, it's not so important as it was in the past, unless your drug is not on the formulary. But I always say to people, look, if you qualify, and I'll give you the qualifications in a second, if you qualify, just sign up. Because let's say, God forbid, in July, you have an issue. Suddenly you have, I don't know, you have tests, biopsies, all kinds of things that are going on, and you think maybe you're having a serious illness coming about. We can use Epic to create a special enrollment period and move you. So if you're on, for example, a Medicare Advantage plan, and you qualify for Epic and you are in need of a better, more comprehensive coverage, we could move you to a supplement. Okay, so that's I always say to people, it's like a lotto ticket. Put it in your drawer and leave it there, and you know exactly where it is. In case we need it, we're going to pull it out and use it. I think one of the other gentlemen last year on our panel said, yeah, it's like a get out of jail free card. So, however you want to look at it, it is an option for those that qualify. In order to qualify, if you're single, you have to be under 75,000 as your income. If you're married, your income would be under 100,000. So those are the qualifications to sign up for Epic. Another thing that I want to bring up that people do not pay attention to and do not think is
Jane, can
important.
I stop you for 1 second?
Sure,
Because we had some
absolutely.
questions about that. So I think, Stephanie, you might be getting confused about the Part D coverage, but I'm going to read the question out loud. So Stephanie asked, she's the same person that asked about the $2,000 max for if it's just supplemental. So you could only carry traditional Medicare and pay max $2,000 a year. Why would one get a supplemental plan? So I
No, the
think we need,
max, yeah. The
mhm.
max is only for prescription.
So that's the D. When we went through
D,
it, that was
yeah,
the D for drugs. So
yeah.
that has, okay, no worries, no worries. You don't have
Yeah.
to apologize. Do not apologize. That's why we
Listen,
have these webinars so that it's confusing.
exactly. And the
Um,
jargon is not easy, and it's hard to get away from the jargon and try to make it so that everybody really understands. And I get it.
yeah,
Not
we
to
love
be.
questions. We love questions. And um, the other thing that you mentioned about different times to change in your enrollment is, if I'm not mistaken, because we've worked with this before, is when somebody is potentially hospitalized or in rehab, and that might be an opportunity, like a change of life in what we call regular insurance, that they could also change. Is that correct still, Jane?
Somewhat, not always. It
Hmm.
depends. There are kind of like a lot of depends.
Right.
I mean, if somebody's just going into a rehab center, that doesn't create a special
Hmm.
enrollment period. Oftentimes we use Epic to move them into that because we know that they're going to get a whole lot more days, so that we could use it to get into a supplement and acquire more days. I mean, there are other times where if you're retiring, you can, change your plan. You don't have to wait until open enrollment to enroll. I mean, obviously, you definitely don't want to go without insurance, no matter what. So if you're retiring, let's say in June, you have 63 days in order to get onto a plan. And normally, we have to know when your date was to retire so that, they can track it. If you're late with either getting onto a drug plan or hopefully not, but getting onto Medicare itself, A and B, you could potentially um, have a penalty.
Right.
I have so many, not so many, but I do have few people that have said, well, I don't take any drugs. I don't need a drug plan. I don't need to pay $50 for a drug plan when I don't take any drugs. Unfortunately, you do. You need to have a drug plan because if in fact, let's say you're 65 today and 15 years from now, you end up in the hospital for whatever reason, and you have no drug coverage, and this happens, and they are using drugs, obviously, to take care of you, to get you well, and so on and so forth. Um, they then know, all right, you have no drug coverage. Guess what? Medicare knows you have no drug coverage. And they will then penalize you because now you have to get drug coverage. So we figure out, okay, what's the best plan for you? We get you on the plan. They have a formula that they will use from the time that you should have signed up at the last, because they give you a special time in order to sign up. I thought I turned that off. I'm sorry. Um, the phone doesn't stop. So they have this formula where they will figure out how much you owe. And it's a certain percentage by the month, by the number of years, and that they come up with that number. So you could have, let's say, a penalty of $70, okay, because you haven't had coverage for quite a long time. That $70 is going to stay with you for the rest of your life every single month. So you need to have coverage, no matter
So
how
get
cheap
that
it is.
coverage.
What's that?
So get that coverage. That is
Yeah, get
super
it.
important. And all of these questions, because we can't go over everything, but we still have more to go. But know that just because you think something is finite and can't be done, please reach out to Jane because there are things that can be done, or she'll at least tell you what the real deal is. Because you don't want to go without because you thought, because their language is not clear, that you
Yeah,
had no other options.
right.
So I'm sorry. No, you were going to
No,
talk about
that's okay.
explanation of benefits.
Yeah, it's just you don't want to be caught, I guess, is kind of you don't want to be caught and then figure out, well, I just didn't know. Well, there's a lot of people that don't know and they don't think that they need it. And so therefore, they don't ask questions and nobody has ever brought it up to them. Nobody's ever challenged them on it. And no one has ever told them. So, now that if the seniors that you do come in contact with, whether it be in your family or your friends or your neighbors or whomever you're talking to, make sure that they understand and find somebody to help them understand. That's the more important thing, to help them understand what they're missing or what they're misconstruing. And please don't listen to your neighbors. This is a very individual kind of coverage. This is not husband and wife and family and everybody being on one coverage. This is all individual. Medicare is one policy for one person. So a husband and wife and friend and whatever, they're on something different, possibly, almost always. So whatever is good for your neighbor is not necessarily good for you. So it's very important to have the research done properly, the information, given out properly, and making sure that you're on the plan that is the most suitable for you. So that's very important. Another thing we wanted to bring up was the explanation of benefits. All of you, I'm sure, have received that in the mail one way or another, whether you're under 65 or over 65. The carrier will send out the explanation of benefits after you have had services. And most people just either put it in the trash or they just put it aside and they don't pay attention. I'm asking you to please pay attention. Do you have to read it? No. But it's a document that is telling you how that claim was paid. I can't tell you how often somebody will call me and then, I had an $83 bill. I don't know what it was for. I had a $21 bill. I don't know what it was for. If you have the explanation of benefits, that will tell you whether you owe that bill or not. So if you have, let's say this is what, October. So let's say in August, you went to the doctor, whatever was going on, you should at least now have had that explanation of benefits. The doctor has sent you a bill for $120. Take that explanation of benefits and go back to that August and September service date. But then it will say to you, if you've read it, if you've ever read them, you'll see it will tell you the date, it will tell you the doctor, it will tell you where it was, and it will tell you what happened. What was the claim for? Was it for physical therapy? Was it for a test? Whatever it was for. Then the next column will tell you this is what the doctor charged. He could charge $1 million, but it doesn't matter what that number is. The next column says, all right, Dr. Jones, this is what you have agreed to pay Medicare. There's an agreement between Medicare and the doctor. So that's what you got paid. And then the next column is what the carrier has paid toward that claim. And then the last column is what you might owe. So now that you have a bill in your hand and you have identified that service and that date, does that bill match? If it does not, you don't pay it. You find out why you have the bill. Doctors' offices and hospitals are very quick to send out a bill. And oftentimes it comes before the claim is received by them. So oftentimes you don't even owe what you have. I mean, I've had this happen to me twice already. One was for like $1,500, $1,800. I don't remember what it was. And of course, the thing that makes you so angry is it's all online. You can't even call somebody and ask them about it. And I kept writing them back and saying, I don't have an explanation of benefits for this service, and you get no response. Finally, I said, well, I have to find a phone number after 3 months of this. So I did find a phone number. I called them up, and the girl was very nice. And she said, oh, well, we sent it to Medicare, but we didn't send it to your carrier. You don't know the bill. What do most people do? They pay the bill, especially if they get it 2 and 3 times. So it's very critical to make sure that any bill that you do receive is something that you actually owe. All right. And you will see that on the explanation of benefits. And I think we pretty much covered the things that we wanted to cover. Are there any questions, or anybody has a situation or something that they need to find out about or don't understand?
You wanted to go over a little bit about, even though we don't know the hard numbers of the changes for 2026 as far as Advantage plans and supplemental plans and what could possibly be helpful
Okay, yeah. And this is kind of
without
creating,
going into the weeds. I know it's a
yeah.
lot, but
But some of the easy stuff is that the Part B, which everybody has a premium for, is going up to $206.50. Right now it's 185. So that's going up to $206.50. The deductible for Part B, which basically the people that, if you remember the left and the right-hand side of the page, The people that are on the left-hand side of the page on the supplemental original Medicare type of coverage, they are the only ones that are really responsible for the deductible. And that would be Part B, Nicole. Yeah, and it's 257 this year. Next year, it's going up to 288. So that is also an increase. And the people that are on Medicare Advantage plans are not responsible for that deductible. Okay. What else? Those are the ones that we know. As far as the supplement goes, obviously they go up every year, but what happens, just so that you know, if anybody here is on a supplement already, about a month, maybe 2 months ago, you received a letter and everybody called and they're going, well, it's going up 17%. No, we don't know. So what happens is that the carrier of the supplement has to propose to the state, to New York State, of what they want as an increase for their premiums. That has to be approved by New York State before they can publicize that that is the new premium. As of today, we don't know. We don't know. So I've had a couple of people, agents, fellow agents who have called, and mostly right now in New York State or in this area especially, United Healthcare is kind of the only plan that we're working with because it's the least expensive. I'll explain that in a minute. So United Healthcare was asking for a 17% increase. And they have not either received it or they have not made up their mind or they have not published it or all three. Who knows? We don't know yet. And the last thing that somebody said to an agent was, maybe we won't know till November. I find that very difficult that they're doing that, but who knows? That's kind of where we stand with that. Now, as far as United Healthcare being kind of the only carrier that we're working with, let me explain how that works. A supplement was put together in 1965. There were 3 companies that put it together. So it has been in the marketplace since then. Everybody who wants to sell a supplement, everybody, I'm talking about carriers, any carrier that wants to sell a supplement can do so. And they can charge whatever they want. However, all supplements are exactly the same. So I could buy a supplement from United Healthcare. I could buy a supplement from Mutual of Omaha. I could buy a supplement from, Aetna in another state. They're all exactly the same plan, but the carrier is going to have a different premium. So that's why in New York right now, the AARP, United Healthcare, AARP is only a sponsor for them. They have nothing to do with the plan. But the United Healthcare is the only plan that is the more affordable supplement, which is why we use that.
Yeah. The other thing that I think is appropriate to mention is how New York and a few other states are a little different from most of the United States
Yeah,
as far as underwriting is
yeah.
concerned, because
Mhm,
we have worked together and I have worked with folks that are moving.
mhm.
And it's really important to have these conversations with brokers.
Absolutely. Yeah. And let's attack moving first. If somebody is moving, please make sure that they understand that they just can't take the plan and that's the end of that story and they'll get covered. They could go to Florida, and if Florida sees that you're getting your drugs, after 3 months at the same pharmacy, they'll drop you. So when you move, all of these plans are set up by state, and the Medicare Advantage plans are also set up by county. So, even if you're going from Long Island to the city, you have to change a plan. So it's important to know that because then people are having, problems with their doctors and so on and so forth. But as far as the underwriting goes, and New York is excellent in this way, we are considered what is called a guaranteed issue state. What that means is that there is no underwriting. You could be in a nursing home and get onto a Medicare supplement and they'll take you. Whereas if you're in Florida and you have, a heart attack or you've had cancer or whatever, they will not take you. They will not accept you on their plan. It is a plan that has underwriting. If they feel fit that, you're not valid for this plan, they will not accept you. So New York is very, very lucky. And I've actually done this where people have gone into a rehab or nursing center and I have written them while they're sitting in the bed. So it's very, very important that, it's just wonderful that we actually have that option. I have had people that will move to Florida and are already on a supplement. So this is another situation. And I always say to them, take your certificate with you from New York. So you can go to Florida with a certificate, change your address, and be covered without a problem. So, because you don't want to go to Florida and say, well, now I'm here, I'm going to sign up for another supplement. I would not recommend that if you've been treated for heart disease or anything else, because you will get, not only will you get denied, but they also will take care of your age. So you get, an extra charge because you're older or whatever. So, age and health is an underwriting portion of almost every single state in the country. I think there's only 4 states that are guaranteed issue states. New
Okay.
York is one of them. So that's really kind of important to know. I mean, I did have a gentleman in Virginia, and his brother was on a supplement. He wanted to get onto a supplement. He had a stroke, but it was years. I'm talking at least 25 years ago. They wouldn't take him. I was really, and he hadn't been treated for it, nothing for years. So that's a very, very important thing to remember.
Yeah. And also always remember, putting on my patient advocacy hat, always remember to check all of your medical records. Those are your records, but as as my husband says, garbage in, garbage out. So if you're not looking, first of all, it could affect your health, right? If you have something wrong with you that you don't actually have, or vice versa, it can affect you a long time away from when it occurred. So just
Hmm.
always check your medical records to make sure that they're accurate.
Right.
Um, and if for any reason you're denied for anything, whether it's life insurance or you're in a different state and it's Medicare, go check why that is. Because again, somebody could, if you don't know it, you could end up in the hospital being treated for something you don't have, or not being
Mhm.
treated for something you do have, along with whatever you're in the hospital for. So that's really, really very important.
Absolutely. And if you are in the hospital, try to have a family member or somebody who can be a patient advocate for you. Trust me, you're not there thinking the straightest that you've thought in the last, 24 hours. It's very hard to be in the hospital, and sometimes you just do whatever they tell you, whatever they give you, whatever, whatever, whatever.
Mhm.
Whereas if there's somebody kind of watching over you, at least you know you're safe.
Absolutely, absolutely. And again, as a patient advocate, sometimes the person who loves you the most is not your best advocate, because it's really hard on the people who love you as well. So it can be a little bit overwhelming, but just a little tip about checking your records. Are there any other questions in regard to Medicare?
Don't be afraid.
Again, that's why we have all of these webinars. It's really part of Care Answered's mission to empower all patients, and this is what this is about. So ask your questions. And of course, you can still contact Jane, and you should. I do all the time to get the information that you need. As I said in the chat, you will see her direct link on Answers for Care, so you can know a little bit more about her, but also just so that you can get in touch with her easily. Everything is there, so you can even message her through Answers for Care. because we've worked together on many clients, with many clients, and I only get rave reviews as far as Medicare is concerned. So we're very happy to have her as part of Answers for Care.
Thank you, thank you.
You're very welcome. All
I know
right.
we went through a lot of stuff and kind of, went over the surface of it, but yeah, I mean, it is important to make sure that you're working with somebody when you are working for your own health care, because it's important to know the ins and outs of what might be particular for you. It is very individualized, and you need to remember that.
Yes, and I'm just going to reiterate that again and again, because people are so used to having like family coverage, or, your spouse and you are covered under the same insurance. It is very individualized. There's many, many couples who, at least if they're doing it right, they're on two different Medicare plans, because it's about what's going on with you. So don't just presume, oh, my spouse has this, so we have the same one. It is not like that. Medicare is not like that. You could be throwing money out of the window,
Yeah.
or you can be not getting enough coverage and then throw money out the window later because you didn't have the coverage you needed.
Yeah, and what do we do as elders? We talk to our neighbors, and and all you do is talk about medicine and doctors, and trust me, just close your ears. It's just not going to help you.
Yeah, and talk to a professional. That's what we're here for. All right. Well, thank you all for being here. As I mentioned, it will be recorded and sent out to you if you missed a little bit. And you can contact Jane on Answers for Care. And we'll see you next month for a webinar to be named shortly, but look out for the email.
Thank you so very much, everybody, for coming. I appreciate it.
Thank you. Thank you, Jane. And thank you, everybody, for coming. And if you have any ideas of things you want to know about, please reach out to me at Nicole@careanswered.com, because I'm trying to get you the information you need. All right. Take care,
Bye.
everybody.
Bye.